One of the most common questions I get in the pharmacy are how to treat dry eyes. It is a very unpleasant feeling, and in this video, I will go over what causes dry eye syndrome, what natural supplements can help, what over-the-counter medications can be used, and what prescription medications are safe and effective for dry eye syndrome. First, let's tackle what causes dry eye syndrome. The two main causes are aqueous deficiency, which is when the eyes don't produce enough tears to keep them lubricated, and evaporative dry eye, which is when the tears evaporate too quickly because they don't contain enough oil. Most people with dry eye syndrome have some kind of combination of these two types. Factors that can influence these things from happening are age, hormone changes, medications like antihistamines and blood pressure drugs, autoimmune and systemic diseases, and environmental factors like poor air quality, dust, or smoke. Unfortunately, there is no gold standard for dry eye diagnosis, so it kind of comes down to trial and error depending on the patient. Other common causes are staring at a computer screen for many hours per day, wearing contact lenses, or following LASIK eye surgery. The problem with dry eye syndrome is that it is a chronic condition with no cure, so it's important to learn how to minimize your risks by taking frequent breaks from a computer or TV screen, for example, and understanding how it can be managed with lifestyle changes, supplements, and medications. Let's go over some natural ways to deal with dry eye. Warm compresses can help loosen up the clogged oils in the glands, which will prevent the tears from evaporating. Also, more consciously blinking will help as well. When we stare at a computer screen, we normally don't blink at a normal rate, so try to follow the 20-20 rule, which is close your eyes or stare at something in the distance for 20 seconds every 20 minutes. Now, there are some natural supplements that have been shown to help with dry eye. The problem is that there is an equal amount of studies that show no benefit. The two biggest supplements mentioned are omega-3 fish oils and vitamin D. The American Academy of Ophthalmology says that there is no strong evidence that omega-3 fatty acids help with dry eye. They've drawn similar conclusions regarding vitamin D as well. However, both EPA and DHA from omega-3s and vitamin D have lots of benefits overall for humans, so I wouldn't ignore them just because they might not reduce dry eye disease symptoms or severity. It's still important to focus on eating a diet rich in omega-3 fatty acids and supplementing with vitamin D if blood levels are low when blood tested by your physician. In terms of herbs, chamomile, bilberry, turmeric, and ginkgo biloba have been used in alternative medicine, but these are not very effective in my opinion, and honestly, I wouldn't bother with these just for dry eye treatment. Okay, now let's start getting into some stuff that actually works for dry eyes. The main three ingredients used over the counter for dry eye are carboxymethylcellulose sodium, polyethylene glycol 400, and propylene glycol. Almost every eye drop that is available over the counter at a drugstore for dry eye treatment will use one or multiple of these ingredients at various strengths. For example, Refresh Tears uses carboxymethylcellulose sodium 0.5%. TheraTears uses the same ingredients but at half the strength at 0.25%. Systane Complete uses propylene glycol at 0.6%, while Blink just uses propylene glycol at 0.25%. Systane Ultra uses both propylene glycol 400 0.4% and propylene glycol 0.3%. These are the main ingredients you want to look for when looking at the label. I wouldn't necessarily say one is better than the other. You just have to try each one and see which one works for you. Normally, I recommend starting with Systane Complete and changing to different brands or ingredients if that one is not working as well as you'd like. Something to watch out for is preservatives when it comes to eye drops. I would highly recommend going preservative-free if you are planning on using the eye drops on a daily basis. And preservative-free helps reduce irritation and the risk of long-term damage to the eye surface. It doesn't matter as much if you are using the drops infrequently, but I definitely would recommend using it for daily use. Now let's get into prescription options that you can consider with your doctor. Inflammation plays an important role in dry eye disease, so naturally an anti-inflammatory agent like cyclosporin would be a good choice. Cyclosporin is FDA approved for dry eye disease, and it should be used twice daily in both eyes to be effective. This comprehensive study summarized the data by stating cyclosporin is no doubt an effective treatment for dry eye in some patients, and its performance is at or above the level of the control. Cyclosporin comes in two different percentages, 0.05%, which is the brand name Restasis, and 0.09%, which is the brand name Cequa. They're the same medication, just Cequa is a bit stronger, so technically more effective, but can also cause more irritation and other side effects. In terms of side effects, the most common reason for discontinuing usage of cyclosporin was burning and redness, so that irritation that I mentioned earlier. You can use it with loteprednol 0.5% to reduce the frequency of severe stinging and burning, but obviously that's another eye drop you have to use with cyclosporin, and that is not a preference for most people. Now, another issue with cyclosporin is although it is extremely common as a prescription medication, it can take up to 3 months to see positive results. That's a pretty long time to wait for your dry eye symptoms to reduce. Xiidra is another anti-inflammatory medication similar to cyclosporin, but it works much faster, usually in about 2 weeks. Other medications that are effective are Tyrvaya and Mibo. The interesting thing about Tyrvaya is that it's a nasal spray that helps with dry eye. In clinical trials, Tyrvaya significantly increased tear production in nearly 50% of patients after 4 weeks. 47% of people who used Tyrvaya had an increase in tears that produced an almost normal or normal amount of tears. Mibo is also very effective, but the problem with these two options are the price. Both close to $700 per month without insurance compared to about $200 for cyclosporin. But if your insurance covers it, they are safe and effective options. In terms of my recommendation for dry eye, first will be to always figure out if there is something that is contributing or making your dry eye worse. Usually dry eye syndrome is caused by things out of our control like genetics or aging, but some things like how long we stare at a computer screen are in our control. So reducing that kind of exposure is important to get ahead of it. Next, I would try over-the-counter medications like Systane Complete or Refresh Tears to see which one works the best for me. And if that dry eye is still bothering me, I'd go with cyclosporin as it is cheaper without insurance, although most insurances cover the medication with the copay. And my last resort would be Tyrvaya once I've exhausted all other options. Thanks for watching.